Brazilians continue to dig mass graves to bury their dead. In Manaus, the largest city in the Brazilian Amazon, the rows of crosses are a visual reminder of the heavy toll the coronavirus has taken in the country. Brazil now has the second highest COVID-19 death toll in the world, an unenviable position, with both daily fatalities and new infections mounting. The World Health Organization says the country is certainly under pressure, but not yet overwhelmed.
The situation in Brazil is of concern. All 27 areas are affected. We've seen different rates of infection. There are clear hotspots in heavily populated areas. There are clearly differential impacts in different populations. We've seen the impact in Amazonas. But overall, the health system is still coping in Brazil.
The pandemic is far from slowing in the country, and the death toll is thought to be much higher than reported. But Brazil has started loosening restrictions and reopening the economy. In Rio de Janeiro and Sao Paulo, the streets were busy on Friday as shopping malls were allowed to welcome customers again. The loosening of restrictions was championed by far-right President Jair Bolsonaro, who has played down the pandemic, calling it a little flu, and claimed that the lockdown has been worse than the disease. But experts say the country isn't yet ready to reopen safely. Testing capacity is lagging, and a contact tracing system hasn't been set up. The fear is that a hasty return to normal may further worsen Brazil's dire coronavirus record.
Let's get more now from Michael Fox. He's a freelance journalist in Brazil and is joining me from the southern city of Florianopolis. Michael, thanks for joining us. Let's get into these numbers a little bit. 42,000 is the official number, but it may be quite higher, and at the same time, the lockdown measures are easing. So get into more of that for us, please.
That's right. According to recent study, the real figure, because of underreporting and a lack of testing, the real figure could be as much as 7 times higher in terms of the number infected, right? And the deaths, it could be much higher as well. It's an extremely complicated moment. And like you said, they're now starting to reopen economies. Sao Paulo is the main place that we've been watching just over this last week. Yesterday, they started to reopen stores. Shopping malls are now open for reduced periods of time. And of course, there are safety measures there. They have to be taking people's temperatures. People can only be in certain stores or a certain number of people, but it's also created these queues outside the stores for people waiting to get inside. Some of the streets are packed like we have not seen in Sao Paulo in almost 3 months. It's extremely concerning because, of course, the country hasn't hit peak yet. We're still far from it. In fact, the number of people infected with the virus has doubled in just 2 weeks. So we're likely to see those numbers continue to rise, and many people are really nervous.
And yet, at the same time, the World Health Organization is saying that the health system is coping. I'm sure that's probably good news to President Bolsonaro. Is that what you're seeing?
Yeah, so that's been one of the things that we've been seeing for a long period of time. It's important to put this into context. So the health system in Brazil is a universal public health system. It's spread around the country. Roughly 70% of the population, at least 70% of the population uses it. It is not equally spread around the country. And that's been one of the most complicated things is the north and northeastern part of the country, the more porous part of the country. That area of the health system is not as robust. And those are the areas where we've seen the health system come near collapse. And that's why we've seen lockdowns implemented in cities like São Luís, Fortaleza, Belém, just over the last month. Now, those lockdowns have been lifted in recent weeks because what they've been doing is as soon as the health system gets almost near collapse, then they throw on the lockdown, European-style lockdown. People cannot leave their homes without possible fines and things like that. So they've started to lift those up, and that's really helped those regions. And so at this point, the health system is still maintaining, and that's the most important thing. But we don't know what this is going to look like within another month or another 2 months.
All right, Michael Fox reporting from Florianopolis in Brazil. Thank you very much.